Hey guys, Dr. Carroll here. Wanted to shoot a quick video for 7 things you can do for mid-back pain. So today's video we're going to focus on all the things that help to balance the thoracic spine. So thoracic spine has 12 bones that make it up. They are colored blue just to show the differential. In the previous videos you saw lower back where the lumbar sacrum. We'll do another video soon called the cervical one, which is the neck one, but this one we're focusing all on the thoracic spine. There's 12 bones here, think 12 months in the year. Now what happens with these is the rib cage, all this stuff that you feel, they wrap around and they actually meet right at these little parts of the spine that wing out there. And they actually connect all the way down. And so whenever you're loosening up and balancing the thoracic spine and getting the nerve pressure off of these, you always want to address the rib cage too. So let's check out the muscles before we go into. When we're addressing the thoracic spine, all these blue ones here, you're looking at this part of the spine from a muscle standpoint. And there's lots and lots of layers of the spine, okay? You have the trapezius, so everyone knows like the upper traps. People think, oh, traps, but actually the traps actually are a big one. There's middle traps here, and there's lower traps, so we're going to give some exercises for that. There's also a lot of stabilizers around the scapula here. We're going to give an exercise for that. We're not going to go too in-depth with the shoulder. That's another video, but we're going to help work all along. Like if you were to pull off the upper trap and see the muscles underneath, you see rhomboids, you'll see paraspinal muscles. We're going to dig into those and get out all those knots and trigger points so we can free up this and get all the nerve pressure off, which is not going to send any signals back to the brain saying, ow, it hurts. Classically, people are like, oh, this really hurts. What can you do for this? Of course, they have mid-back between the shoulder blades, maybe a little bit off to the side. They're like, oh, I got a pain right there. These exercises are perfect for people like that. Quick caveat before we get into the exercises. If you see the mechanics of how this part of the spine is stacked up, these are called the facet joints. This mid-back is actually designed to do more rotation than any other part of the spine except for the neck. So whenever you're a golfer or you're twisting or any type of rotational sport or exercise, the majority of that motion should actually come from the mid-back. So many people get this area locked up, and so the brain's like, well, if I need to rotate and I can't get it from my mid-back, let me just chew up my lower back and get some extra. And that's typically where you'll get a lot of lower back injuries in any type of rotational thing. So if you've ever injured your back during a rotation, yes, we can fix this lower back, but you have to address the reason that this got overforced, which was the mid-back mobility issues, okay? So exercise 1 for thoracic mid-back pain is starting to get the extension flexion back into that part of the spine. So many people have bad posture, they're hunched over. This is good for any age group. This is going to be good for about 90% of patients. I do have a couple patients that don't like this, so if you do this and don't like it, just use judgment call, right? It's common sense. I'm making a video and trying to help everyone. There's going to be specific things that I can't tell about you because you're watching a video. I don't know your specific spine. But this is going to help most people most of the time. So what you do is called the cat camel. You're going to breathe in and you're going to basically create a cat, right? So breathe in, round your back, get that nice flexion, and then breath out, and you're going to create some extension. Breathe in, round your shoulders, round your back, flexion like a cat, extension, I guess like a camel. That's what they call it. Breathe in. And you're going to start to create some more and more mobility in there to loosen everything up in your mid-back. That's called the cat camel. So second one for mid-back thoracic issues is we're going to add a rotational component. This one feels awesome, especially if you have a desk job. So what you can do is just sit kind of like heels right on your butt here. If this is too much and this hurts your knees, you can find a variation and sit on the side of a table or a chair like this and bend over and go like this, but I'm just going to show it from the ground for now. So you sit here, hand behind your head, you're going to rotate towards the elbow. You're not going to do this, you're going like this. So you're just come up and down. Obviously, you don't want to necessarily do this in a button-down shirt because the fabric kind of limits you, but you get the idea. You're going to rotate, and this one feels awesome. This is both a mobilization and a little bit of a strengthening because you're going to help to get some scapular strength there. You're going to do that on both sides. Do that for a nice set or two of 20 of those. you'll be a little surprised. You'll find usually one side's a little tighter than the other one. Do an extra set on the tight one, okay, until they're both balanced. That's number 2. So the next one we're doing is called a thoracic open book, or that's what I call it. I don't know what the official name for it is, but essentially you're getting down on your side here. You're going to put the top leg over like this to create a little bit of a torque here. And what you're going to do is your hands are together here, just kind of stabilize your neck. Don't necessarily let it go forward or back like that. And you're going to just reach across. And when you feel like you start to get to the end of your anatomy, you can let the knee come up just to get there. And you get a nice stretch there. Come on back. Trying to take it as far as your anatomy will go. Then you can let the knee come up to finish the rotation of the floor if you want. You get a nice rotation, a nice stretch. Obviously, do this both ways. Top leg over this one, right? Hands together like a book. Keep your neck neutral. Go over as far as you can. Allow the knee to come up so you're not totally wrenching your lower back. I'd rather this be a mid-back thing. But you will feel a nice stretch in your lower back too. I love this one. I feel like I could fall asleep. And that's the thoracic open book. Next thing we're doing is the scapular pulls here. So one of the most underlooked muscles in the body is the serratus anterior. It actually connects from the underneath of the scapula, and it actually wraps around the rib cage here and connects here. You'll see boxers really develop this, and it connects right into the core. So the core and the scapula actually have that connection via this muscle. And if that muscle is inhibited or isn't moving, you'll often get super tight traps, and people will be like, it's kind of so tight here. Well, one of the reasons it's tight here is because the brain is upregulating this to stabilize the shoulder, because this muscle isn't stabilizing and moving the scapula well. And your mid-back will get all tight. So this is a simple exercise to start getting that movement and strength in there. So you're going to sit here. You can kind of sit on your butt. Again, choose the chair variation if this hurts your knees. But so you're going to do palms to the ceiling. Grab some type of rope, not a rope, a therapeutic band. If you don't have a band, you could theoretically use a t-shirt. Ideally, band is going to be better. Okay? So right here, you pull, relax. Pull, relax. Notice my neck is not like this. Notice my neck is not like this. It's in a closed packed position, the safest position for your neck during this exercise. You're gonna feel this burn. This feels awesome. I challenge you to get to 20 of these. If you are any type of a baseball player, throwing athlete, javelin thrower, anything like that, you have to be doing this exercise. If you're bench pressing and you're starting to get shoulder pain, have to do this exercise. If you have a desk job, you should probably do this exercise. Good. Next thing we're going to show are the Ys and the Ts. Everyone has seen these. The reason that we're doing these is that, remember that diamond-shaped trapezius that I showed at the beginning of the video? Well, the mid-trap and the lower trap usually are atrophied or underfunctioning, inhibited in most of the population because their posture starts going like this, they're typing a lot, maybe they've had an injury before, but anyways, either way, they're kind of like this. These muscles bring the shoulders back and down, takes a lot of pressure off the neck. A lot of neck issues come from trap issues, okay? So this is the easy one. You get into this position, 45 degrees is going to get more of the lower trap, 90 degrees is going to get more of the mid trap. Just look at the fibers in your anatomy textbook. Okay, thumb up like this, squeeze your shoulder blades down and together, and down. To make this a little bit harder, you can get an exercise ball and put your belly on it and just lay your arm off like this. You can also go to like the side of a bed or the side of a table. Obviously you don't have a chiropractic table, but the side of your bed, you can do this. It's a little bit more challenging. Go with where your skill set is, okay? So you'll do 10 or 20 of these, and then you'll come out here, thumbs up, 10 or 20 of these guys. That's going to develop, well, you'll get some rhomboid, but you'll also get mid-trap that way, okay? When it feels too easy to do those, start to grab some weights. Like a Campbell soup can is an easy one, and then try to progress up from there. Okay, so the next one we're going to do is the thoracic mobilization with lacrosse balls. Now obviously through a video I can't adjust you, but we still have to break up some of those adhesions in the paraspinals that get this all locked up. And one of the simplest ways you can do at home is you get two different lacrosse balls like this, and you can wrap them like this with some tape. So I just did this. I wrap these around, and then you wrap them this way, and you create this kind of unique shape here. It's like a peanut. I actually think you can find these online, but it's easy to just buy 2 lacrosse balls and do this. And the idea here is that space here, you could use a foam roller, but I like this because it's a little bit more specific instead of just less specific, I guess you could say. So what you do is you get these are called the spinous processes. When you feel along your spine, there's the bones that stick out. You can see them when you're rounded over and stuff like that. You're going to put that right there, and you're going to roll up and down, and you're going to find some spots in your spine that are really locked up, and there'll be more tension and pressure there. Hang out there and roll along there, okay? So I'll show you what it looks like from this angle. So first, you make sure it's perpendicular to your spine. I would start at the bottom first, okay? And you put it right in the middle of your back, and you just kind of use your body. You can use your heels, you can use your arms to kind of pick up. And if it's too much pressure, like right here is my lower thoracic spine. I just played hockey last night, so I can feel that's tight. You can use your arms and your hips to pick up to limit the amount of pressure that's going back into it. And then if I want to increase the pressure and increase that, you'll feel a little bit more sore into the muscle there. Feels awesome. I love that. And then when you feel it to start to release, spend some time on those. Move it up. Find another spot. Like that spot's not too bad on me. But that spot right in there, I can feel that. So I'll just kind of like hang there and rock it. I can also go side to side, get a little bit variation. If you feel like it's like sharp, don't do it. That means that the balls have either missed and you're pressing on that spinous process there, or it's something else, and just stay away from that spot, okay? Oh, that feels so good. I love this. So you'll do lower part of your mid back here, you'll do right between your shoulder blades, and then you'll do right at the base of your neck. Obviously not your neck, but just in the back there. This is a common place for people. So you put it there, you'll find the spot, make sure it's right in the middle, and you get there. You kind of rock back and forth if you want to find some spots. Ooh, that's a nice one right there. And you just breathe in and out, and you'll feel the muscles start to relax after 20-30 seconds, up to 2 minutes. You can do it on each spot. I feel like this could put me to sleep. So last but not least, we got to address the rib spine articulation. So when the rib cage, when it wraps around here and it gets to the back on the spine, it meets right here at the transverse processes. Sometimes these are misaligned, and you'll get gnarly trigger points in there that feels like someone's just like sticking a stake in you. It's very painful. When I find these on patients, they're like, oh, that's good. When we adjust it, it goes away. But since I can't adjust you on this video, we're going to show you, we're going to use lacrosse balls, yoga tune-up balls, or tennis balls. A lot of patients, if they've had a lot of pain or tenderness or just a rigidity and they're an older population, you're going to want to start more with like the tennis ball. The more athletic and the less pain or dysfunction in this area that you have, you want to progress more towards like a lacrosse ball. And so what you're going to do is, it's not going to be like the previous one where it's like this. You're going to be more like in the belly of the muscle next to the spine, and you're going to be working up and down that. It feels awesome, and it's going to release all that muscle tissue around here so it can free up the ribs to breathe better. You're going to notice you're going to be able to take deeper and deeper breaths after this. So I'm not going to do the tennis ball or the yoga ball. I'm going to do a lacrosse ball because I've done this enough where I've got my muscles used to this. So it's not right on the spine, okay? It's not like right on the spine, you're a little bit off to the side. So if you want to zoom in, right? It's basically between your scapula and your spine. There's a nice little groove in there. And you get right on there, and it feels so good. Like right there is really good. To add a variation, you can bring your arm up, and you can bring your arm down. And when you really bring your arm across, you're pulling that scapula out of the way, and you're really getting deeper into a tighter locked up area there, and you're going to feel that. If it's too much, back off, roll your weight off it a little bit, roll your weight back on it more to increase the pressure there. Vary it up. Then you'll slide down, you'll get it a little bit lower along your spine, moving your arm like this, this one isn't as bad for me, so I would actually stay here and do this for a while. I played hockey last night. I hit a couple slappers for the first time, and this feels awesome. So keep doing that, and then you get a little bit lower down, right at the bottom of the scapula. When you get into the bottom of this mid back here, the ribs change a little bit. The arm won't do as much for you. You can kind of like rock like this back and forth, and that will feel better on the lower rib cage down here. And then once you get it low enough, you'll get to the point where it doesn't feel like anything. You've now reached your lower back and you're in that QL muscle. You can keep doing it if you want, but that's not part of the mid back. So that is the 7 things that you can do at home to start reducing back pain in your mid back, reducing that rigidity, increasing your athletic performance, getting more out of your body so that when you have grandkids, you can pick them up and play with them. All right, take care.